Hey class, my name is Dejane Lewis and I hope you guys enjoy this presentation and let's get started. With our vision and our value with these masks, we wanted to make sure that the main important thing is health. We wanted to make sure that the health of our patients and employees when wearing these masks are being tended to at all times. We also wanted to make sure that other things were tended to as well, such as skin. When using the typical disposable mask, I've noticed not only with myself but with others around me, their skin tends to break out from the irritation of the mask, and also other minor things as well. We also want to make sure that these masks continue to fight the spread of COVID-19 and also other illnesses and diseases that are airborne that spreads throughout the hospitals as well. So our problem is that not only that we're living in a pandemic, but to reduce the spread of COVID-19, we have these typical disposable surgical masks. These masks are only effective for 3 to 4 hours. But a typical person who can, let's say, be on the line working can wear this mask as long as 10 to 12 hours depending on their shift, which is not good at all. These masks become less effective the longer you wear these masks. So our goal was to make a mask that is not only helpful for people while working, but also effective longer. Our mask is targeted to be effective for 24 hours at a time before washing. The disposable masks that are already used nowadays contain polyester with chlorine compounds, which is very harmful to the lungs and the respiratory system the longer that these masks are used past the effective hours. Our target market and community is mainly nurses because they are the front line, and also people who's in the healthcare industry, but also people in the public as well, and patients. So our solution, like I said before, is the effective mask, and that will definitely help to protect our respiratory system, and we also want to make it affordable for people to use in the public as well. So for our revenue model, our goal is to make at least 20% commission off of each transaction that we do sell for the mask. We also wanted to do a minimum fee of $7 if people do buy masks of bulk of minimum 20 masks or more. And there's also a $3 fee for the mask that is in 19 count or less, whether it's together or if it's individually. And then also our goal for next year, 2022, the fiscal year, we want to make maximum total of $10 million, and the minimum, as you'll see in the financial section, is $3 million. And the reason why we have the price for the fees is because of the material that we actually use for the mask. For our marketing and sales strategy, what we wanted to do first off is to have multiple events at different hospitals monthly. The maximum amount of hospitals that we wanted to target was about 8 to 10 hospitals each month, and we just wanted to educate people on the effective mask and also to just educate people on COVID-19 in general for people who really wants to know a little bit more about it, and the precautions that they can take if they haven't done it also already. We also wanted to partnership with social media such as Instagram, Twitter, Pinterest, and Facebook. Social media is a real great way to advertise our mask and just put our names out there. And then also in the near future, once we get a good revenue, we wanted to also advertise on televisions and also platforms such as YouTube. We are the right fit because we are the public. We know exactly how the public will react because we work with the public day in and day out. which means that we are very much so relatable because we are connected to the public. As taking care of the public on a regular basis, we know the needs and wants of people, so it won't be too hard to get their opinion on the mask. Though as a team we will not be as experienced, but we are very hungry, determined, and a dedicated team to make sure that we make these masks a great success. For our top section, what we wanted to show for the effective mask was the amount that we were asking for, which would be the minimum of $3 million. And we wanted to sell these masks for $15 each. 3 million might sound like a lot, but it actually isn't when these masks are being sold to the public and also to our hospital as well. People in their daily lives use at least 3 to 5 disposable masks a day. So we expect for our sales to increase with the minimum of $50,000 to $150,000 as the month increase. Our goal by the 12th month is to sell $1 million worth of masks. Our annual total is estimated towards $3 million. We wanted to just show as disposable face mask market will decrease as the years go by, starting from around 2023. The only reason why disposable face mask market is so high right now is because of the pandemic. But with competitors such as Honeywell, 3M, and Kimberly-Clark, they are the biggest competitors, I should say, right now. What makes us different is the fact that we sell from the hospital straight to the public. With the face mask market skyrocketing right now, our goal is to hit $3 million for our first year. 25% of our profits will be donated to hospitals in low-income areas that are in need of funding. We also wanted to continue to educate people in not only our hospitals, but in other communities around the DMV area to protect themselves against COVID-19. We also wanted to use majority of our profits to fund our own hospital to make sure that it's up to date, and also making sure that our patients and employees' needs are also satisfied. Thanks, class. I hope you guys enjoyed my presentation. Thank you for listening, and I hope you have a good day or night.